Senator Cormier. Thank you, Madam Speaker. Colleagues, on February 7th, Canadian Foundation for AIDS Research, or CANFAR, unveiled its strategic plan, which notes an alarming increase in HIV cases in Canada. In fact, the Public Health Agency of Canada reports 1,833 new cases of HIV in 2022, mainly among men aged 30 to 39. This represents a 24.9% increase in new diagnoses compared with 2021, the highest increase in more than 10 years. Saskatchewan and Manitoba are the most affected provinces, with 19 and 13 new cases per 100,000 inhabitants respectively, compared with a national average of 4.7. As CANFAR states in its strategic plan, and I quote, Canada's HIV epidemic was fueled in large part by health inequalities, reduced testing services during the COVID-19 pandemic, the lack of comprehensive sexual health education for youth, the toxic drug crisis, and the absence of culturally appropriate testing and care, end quote.
The Canadian Foundation of AIDS Research estimates that approximately 1 in 10 Canadians living with HIV are unaware of their status and have not received life-saving antiretroviral treatment. Stigma, racism, homophobia, and transphobia are other barriers that prevent people from getting tested without fear or judgment. Lack of sexual education in schools, discrimination towards LGBTQI+ communities, particularly toward trans young people, restrictive public policies, those are all factors that increase discrimination and don't help eradicate this virus. So what are we going to do to change this intolerable situation, colleagues? As you may recall, 4 years ago, I tabled a motion in the Senate that was adopted the same day thanks to you, urging the government to increase funding for the federal initiative to address HIV/AIDS to $100 million annually. While applauding the efforts of the federal government, sustainable funding for community response here in Canada is still lacking, and inequities are growing. We need more support for the organizations. We need to give better access to PrEP, to self-testing, to medication and other measures, and we need to stop discrimination.
39 million people in the world were living with HIV in 2022, and 630,000 people died from it. Behind these figures are women, men, and children from all walks of life, all origins and all regions of the world. Colleagues, HIV is not a virus of the past. It's with us today, and it's particularly preying on our youth across the country. UNAIDS and its member countries, including Canada, are committed to ending the AIDS epidemic by 2023. Time is running out. Let's act together now. Thank you.